I am Dr. Ahmed Radwan. I am the Dean of the School of Health Professions and Education at Utica College. We prepare students for outstanding careers in healthcare and in education field. You can think of it as two divisions in one school, so health professions in one end and the education programs on the other end. We have the undergraduate education programs as well as the master's programs in education. So far, if you want to be a teacher, since it's a requirement to hold a master's degree in education, that you graduate from a different major, let us say math major, and then have the prerequisites and then end up in your master's of education at Utica College. But actually, starting next year, we are launching our undergraduate education major. And we think this will be a huge help for the community within Central New York. We have excellent faculty members. They're well known, not only statewide, but nationwide. What makes us unique is our one-to-one approach and our care for our students. When we move on to the health professions end, we have the health sciences program for the undergraduates. We have the psychology child life program. We have therapeutic recreation program. We have wellness and adventure education program. We have physical therapy under and graduate. And we have occupational therapy at the level of undergraduate and graduate. We have a lot of nursing programs at the level of undergrad and grad level of education. And we are really well appreciated nationwide for the quality of our programs. We have the undergraduate nursing program. And with that, you graduate after 4 years with bachelor's in nursing. And as soon as you pass the licensure exam, you are a registered nurse. And then we have the master's program in nursing. So you can actually, after becoming a registered nurse, you can join the master's program and in 2 years or so become a family nurse practitioner. Others used to get the registered nurse degree through an associate degree in nursing from community colleges. And for those, if they want to advance their study, we offer the RN to BS program. So they come to us with their associate degree as a practicing registered nurses, and they get the remaining 2 years and obtain their bachelor's degree here at Utica College. We also have something called the Accelerated Bachelor of Science in Nursing, about 18 months of concentrated nursing study, after which you become also holding a bachelor's degree in nursing. And the study is mainly online for the ABSN program with some ground hands-on experiences. We have health sciences program, and it's a wonderful undergraduate 4-year program that prepares the students who have an interest in becoming physical therapist or occupational therapist, or to join nursing at a later point in life, or to join the athletic training programs later on in life. We also have the physical education and wellness program, and this is the program that prepares phys ed teachers for their future career, in addition to the exercise and wellness tracks for those interested in serving these careers in their future. Same thing about psychology child life program. You can certainly join that program and either after 4 years decide to continue, get your master's in education and become a teacher, or decide to work as child life specialist and get your career in healthcare. Last but not least, we have the Therapeutic Recreation program. And this is a licensed profession. You get your license and you work as a therapeutic recreation specialist upon graduation, as long as you pass the licensure. If we talk about physical therapy is a licensed profession. So you not only are expected to graduate, but also to pass a national licensure test. Our graduation and retention rate are perfect. And so is our pass rate at the national level. So we are governed by an accreditation body, and we have to meet these standards in order for our accreditation to continue and to survive. So our numbers are monitored by our accreditation body standards, and we do meet these standards. It's a doctoral degree, so it's 3 years past your bachelor's degree. So people can become physical therapists either in 7 years, 4 years undergrad and 3 years grad, but we actually offer an accelerated track to becoming a physical therapist, which is only 6 years. So you get 3 years of undergrad, and then you jump in and join the graduate program after that for additional 3 years. So for promising students, they could save 1 whole year that way and still earn their bachelor's after 4 years and then their doctorate after the remaining 2 years. Occupational therapy have similar pathways. So you can join occupational therapy after your bachelor's for 2 years. It's a master degree so far, but soon we will be launching our post-professional doctoral program in occupational therapy. Or you can join from the beginning at an accelerated track where you get 3 years of undergrad and then 2 years till you end up gaining your master's. Same thing, we have national exams, and it is an accredited program where our numbers for graduation retention and successful licensure are well monitored. Nursing is the same thing. We have excellent graduation and national rates, and our licensure numbers and successful completion of the license is well monitored by the nursing accreditation body. And I'm really happy because these numbers keep improving, and the faculty are really well qualified at Utica College. The faculty in these programs are not only experienced, but they do have national presence. Our faculty are participating well in the national agencies that governs the professions. Our faculty are very well present as exam writers for the national exam throughout the country in the different professions. Our faculty publish in respected journals. They present at national and international conferences, and most of the time the students go with them to these conferences, and they do present as well. And this is what makes us unique. I think it's the undivided care that we give to our students, and the one-to-one relations with the faculty members is what makes us unique. Most of our programs operates at, especially that has hands-on experiences, operates at 1:12 or even 1:11 faculty to student ratio. And I think this what gives the students what they need. It's the comfort that whenever you have a question, your professor is there for you. There is always demand not only on the nursing services, but on all the other health-related professions. So we're talking occupational therapy, physical therapy, therapeutic recreation. All of these are in high demand right now. And the good news is our lifespan is actually increasing, not decreasing, which means these programs and that type of professions, the demand on them will even increase in the future. Our students, as soon as they graduate, sometimes even before passing the licensure, they end up getting employed. We have students from all over the country. We even have international students into our programs. So our grads get very well employed either locally or throughout the country or even worldwide. It's really amazing how you hear about 100% employment for a particular cohort as soon as they just pass their licensure or even before. Some of them get offers from their clinical sites that they got their clinical training in as still before graduation. But they get offered these positions and they do accept them. We maintain good relations with clinical sites, and we listen to their feedback, and we try to improve the quality of our teaching based on the stakeholders' feedback of our grads. And it's really nice to hear that our grads are not only at the level but exceeding the level of where they should be in terms of their skills as well as their professional behaviors. We're not only graduating an academic person, but we're graduating a successful professional. And our alumni, since they are successful, they establish successful businesses. And we make sure we maintain the relation with them, and we send them our students to get trained at their facilities. So it's like a mutual benefit, and it's a lifelong relation with our graduates. And again, this is something that matters. We are an educational institute. We really care about all aspects of education, and the achievement of our students is our top priority. We may not be able to generate theories because we are not an R1 institute, but still we are able to solve patient problems through our research. And that translational and application type of research is quite important.